Community Conversation, we are joined by Dr. Amna Sohail, Assistant Professor of Neurology at UVA Health. She's sitting down with Aaron.
Dr. Sohail, nice to meet you. Thanks for coming in today.
Thank you for having me.
You're very welcome. So you're here to talk about Stroke Awareness Month, which May is Stroke Awareness Month. We actually had an interview on that yesterday as well, but it's good to keep talking about it because it's an important topic. So first things first, what is a stroke?
The stroke is a medical emergency. It is a sudden loss of a function of a region of the brain due to interruption of its blood flow carrying the oxygen and vital nutrients required for its normal function. It can be due to blood vessel blockage or a blood clot, which is known as an ischemic stroke. Or it can be because of bursting of a blood vessel, causing abnormal accumulation of blood either within or outside the brain, which is known as the hemorrhagic stroke. Hemorrhagic stroke, in addition to interruption of blood flow, can cause brain injury due to pressure and inflammation caused by the blood products. About 87% of all strokes are ischemic strokes.
And I'm guessing, well, I know that treating a stroke quickly is key. Why is that so important, fast treatment?
Yes, fast and timely treatment of stroke is crucial because within minutes of being without oxygen and important nutrients, the part of the brain that is affected, it starts to die, leading to irreversible damage, which can increase risk of permanent disability or even death. Prompt treatment can minimize brain injury, it can improve recovery and decrease the risk of long-term disability and complications. That is why we strongly recommend that as soon as stroke symptoms are developing, noticed, or recognized, to immediately call 911.
And what are some of the symptoms of a stroke?
Any sudden neurologic symptoms, including sudden onset of weakness or numbness on one side of the body, difficulty speaking or understanding, visual loss or any visual changes, confusion, sudden onset dizziness, balance difficulties, coordination difficulties, loss of consciousness, or a severe headache.
And what treatment options are available at the UVA Health Stroke Center?
UVA Medical Center is a comprehensive stroke center with 24/7 access to state-of-the-art treatments for both ischemic and hemorrhagic stroke. This includes the clot bursting medications, which can be given within 4.5 hours of an ischemic stroke onset, emergent clot retrieval if necessary for an ischemic stroke, medications to prevent another stroke, procedures like stent placement or cleaning up cholesterol plaque in the abnormal vessel when needed or applicable, as well as access to stroke rehabilitation. In addition, UVA Medical Center also provides specialized hemorrhagic stroke care, including treatment for brain aneurysms and other brain vessel malformations. Our team comprises or consists of specialists that include stroke neurologists, interventional neuroradiologists, neurosurgeons, stroke physicians, emergency room physicians, as well as our neurocritical care physicians, our stroke-trained staff, stroke-trained therapists, as well as our stroke coordinators. In addition, UVA Health also has ongoing stroke clinical trials, including acute stroke trials, offering access to new treatments and technologies.
That's wonderful. You have a large, experienced, talented team, and that's fantastic to hear. So thank you so much, Dr. Sohail, for coming in today. It was nice meeting you, and thanks for providing that information.
Thank you.
You're very welcome. Steve, over to you.